Okay, so here we go. We're going to hopefully finish your analysis. And we're recording. And I'm going to share. Y'all can see my screen that says physical characteristics of urine? Or no?
Yes.
Oh, you can? Okay. Wonderful. All right, so yesterday when we left off, we were talking about the different colors and concentrations of urine. And I told y'all might be a new word for you. It's the word turbid. Clear urine, you'll be able to hold to the light and see through it. Something that is turbid or opaque, you won't be able to see through it. And this is usually due to pus or some type of infection that's causing it. The color of urine normally is going to be a straw and a pale yellow. Vitamins can change the color of urine. Vitamins can also change the smell of urine. So depending on if your patient's on certain vitamins and supplements, that might have a big effect on their urine. Diuretics, like water medication, pills to, make somebody urinate, is probably going to cause their urine to look clear because they're urinating so much. If you see a patient with dark or reddish urine and they're not on their cycle, that's not a good thing. That's a bad thing. There's another time where you might see orange or even green urine, and normally that person is on a medication called pyridium. And pyridium is used, and you want to jot this down somewhere, but pyridium is basically a dye. That's its function. But when it's used inside the body, it has a muscle relaxing reaction to the bladder. So it's used for bladder spasms, and people have those with UTIs and stuff. All right. Females, if their urine appears bloody or red and streakish, that could just be that they're on their cycle. That's why we always ask women when their last menstrual cycle was and that kind of thing. And then what does your pee say about your health? If it's clear, like just completely clear, you honestly might be a little too hydrated, or you might be on diuretics. That's not the end of the world. If it's pale yellow, like that straw yellow, that's really good. That's what you want. Okay. Dark yellow you need to drink a little more water. Brown is either liver function issues or blood in the urine. Okay. And then pink or red is fresh blood. And then blue or green, like I said, that could be supplements or medications. Or food coloring. If you've ever gone to a kid's birthday party and they use that one food coloring, it will sometimes change your poo and your pee and make it the color of whatever that frosting was that they had on the cupcakes. Odor is normal. Urine is going to smell. Some people have a more potent smelling urine than others. People who tend to drink a lot of water have a less potent smell. But certain foods really affect the way that your urine smells. Asparagus is one of them. Believe it or not, cornflakes is another thing that affects the smell of your urine. And also vitamins. I know my urine has just a real odd smell, and it's because of all the supplements that I'm on. And that's normal. That's just how it is. Now, if you took the lid off your patient's specimen cup and it smelled foul and it smelled like just something that was just wrong, that's probably a sign of infection. That's probably, something bacterial that's starting, that's growing in there. Normally, our body is going to produce, depending on how much water we drink. And this is something you need to know. In a 24-hour period, we're going to produce 700 to 2,000 milliliters of urine. The average, so if you was to take it in between, is about 1,500, and that equals 3 pints. Okay, so what that means is the average person is going to urinate about 3 pints of urine a day. Okay, and this is important that we know this, because there is a time where a patient might have where they have to monitor what's called their I's and their O's, their ins and their outs. And that you might have to explain that to them. You might have to say, okay, the doctor wants you to measure everything you drink and then measure every bit of urine that comes out. Okay, so if you ever hear that term I and O's, that's what it means. Polyuria, okay, this is a term you should know, and it means excessive amounts of urine. And this could mean somebody's diabetic or kidney issues or infection sometimes as well. Olguria means a decreased amount of urine, and that can be dehydration or illness or kidney issues, right? And then we heard this word before, anuria. That means the absence. There's no urine being produced. And that's usually from kidney failure or trauma. And y'all can always go back and write this down. Specific gravity, and I think this was your question for today. Specific gravity is a wonderful way, a quick, easy way to tell exactly how the kidneys are functioning by basically telling you this person's drinking enough water or this person's dehydrated. And that's what it's going to represent. When we see abnormal numbers, I'd say for 85% of the population, unless you go work for a nephrologist or urologist, when the average person, when you see a specific gravity that's off, not in range, it means they're dehydrated. So, but I mean, it could mean other things, yes, but for the most part, we're associated with dehydration. Now, some of y'all who've already been to lab, you've got to do urine and perform the urinalysis test with the dipstick. These are called reagent strips, and there's usually a couple hundred in one bottle, and the side of the bottle has your guide. And I have a video that I'm going to show in case you haven't been to lab yet, and it'll show you how you read this and how that you watch and monitor for 20 seconds, 30 seconds, 60 seconds, whatever the bottle says. But it not only tells you how long until you read the test, but what the ranges are. So it's a really easy, simple test to perform, okay? And they're usually, I've seen some that have 3 strips on them, some that have 10. So there's different types. So don't be surprised if you go to you go work for an endocrinologist and they're just testing for their diabetic patients. They only maybe test using the 3 strip with the glucose and the specific gravity, and I can't remember what the third one was, but I think it might be protein. But so different doctors might have different types. All right. Now it's important, and the video that I show you will walk you through these steps. But it's important to know that ever since day one, I've been talking to y'all about homeostasis and the importance of that balance, the importance of maintaining homeostasis. And what is that? That all comes down to pH. That's our body's regulatory. We know that blood has a pH of right about 7. And if we look at that, that's between a scale of 0 and 14. So where does 7 fall in that? smack dab in the middle, right? So I actually have a little work. It's like a little study. It's a cheat sheet that I'm going to post for y'all in Teams. And it's a little graph, and it shows the body's pH in all of the different areas. Like in the stomach, you would expect to see a pH of 2.2 or 3, right? Something real acidic. And then more neutral would be like our blood, right? And then something that's alkaline is I think the lower colon at towards the end of the rectum, those areas there. But I want you to remember, and I want you to know that the normal range, so write this down, okay? The normal range for urine for the pH should be 4.6 to 7.9. So 4 to basically 8, okay? Anything under or anything above could mean there's some issues, okay? And this is why when I was telling you yesterday how vital and how important it is that when you get a urine sample from your patient, that you run that urine while it's fresh. You do not allow it to set. You don't wait before you take the reading from it or before you collect a sample to send to the lab. You do it right away because urine does change the longer that it sets. And so we don't want that. We don't want our patient to have to come back in because we did something incorrectly. The other test that we see on the reagent is one you might hear it referred to as albumin, but it's checking for protein, okay? And albumin is a protein, and it's normally something that is not found in a healthy person. So if you see a patient who has a positive albumin or protein, that tells you, there's a few things that could be doing that. Now, the most common that we're going to see right now with that is somebody who's on a keto diet, because they are packing in massive amounts of protein, and so that they're pouring off that. The excess is going to their urine. So that might be a cause for it. Like right now, if I pee, I definitely would be positive for albumin because I've been on a very strict keto. Acute stress can also cause this, and there's other medical conditions as well. But you just need to know that if you see, the protein or albumin, that it is not supposed to be there, but it can. There's something called proteinuria. This is the presence of protein, basically. And when this is because of this, and if it's not because of a keto diet or stress or something like that, it could very well be because there is renal dysfunction and damage. And we remember how we were talking about the glomeruli and the filtration system of the kidney? This is something we would want to be alert and watch out for, especially if we had a renal patient or somebody with a prior history of kidney issues. And this is known as glomerulonephritis. And basically, it could be the patient has something physically wrong with the filtration system itself, or it could be from infection, often strep, believe it or not. And then I just did my lecture to my other class, telling them and talking to them about high blood pressure and the effects it has on the kidney. So yeah, untreated high blood pressure can cause this. So can diabetes, chronic heart failure, and preeclampsia. Me and my misspelled words. Preeclampsia, you know, that's high blood pressure during pregnancy. These can also be causes that we might see excessive protein. Okay? Now, glucose should not be in a patient's urine. So when you're writing down glucose, you put, nope, that's a definitely you want to see negative. Okay? But we do see it at times, especially if our patient is diabetic and they're not controlling their blood sugar, or their medications are not working properly, or they're under a massive amount of stress, they have a severe infection, and then there's another thing that can cause glucose to spill into the urine, and that's Cushing syndrome. Yeah, remember when we talked about the endocrine system, I told you it was like that moon pie-faced? That Cushing syndrome can cause glucose to appear in the urine as well. And that makes sense because it is an endocrinological related disease. Um, and I always bumble over this word. Glycosuria is the presence of sugar in the urine. And we don't want that. We do not want glucose, which is sugar, to be in our urine, right? And so the threshold for this, and the numbers are 160 to 180. But when you do your dipstick, you want it to see this bright blue. You want it to always be right. You don't want it to go into its other ranges. Sorry. And then this is what I want to show you here. This is an example. Now this is only 1, 2, 3, 4, 5. A 5-test dipstick. Okay? Now, this is showing you, okay, what, and usually this is kind of how it works. You'll line up once, and it tells you 60 seconds. So once you put the urine on, you're going to wait 60 seconds and check glucose. If it's this color, it's negative. It's 0. If it's this color, it's got a trace, or 5. Some doctors may have you write the number, or they might have a sheet that you can circle the color that it was. And some places are fancy and have the little machines that you put the the dipstick in, and it reads it and prints you out a record of what the urine is. So it just depends. Now, protein here, remember, we don't want to see protein, okay? So if we do see protein, we'd write down what we saw. So say our protein right here was 3.0, and then that's a plus, 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 right? So some doctors might just have you put the plus, plus, plus. Some might have you put the 3.0. Some might have you put both. So just be prepared. And you see pH, this is what we want. We want somewhere right around 5, because when we go back and we looked at the pH, right, we see here the normal ranges are 4.6 to 7.9. So we come back here. So anywhere around here is good. I know when we start, even though it says 7.9, if we start getting to the far side over this way, this is usually where we start seeing patients who are dehydrated. Now, blood of course should be negative, but if we have a female, we're always going to ask, when was your last menstrual cycle, right? And if it's not, and they say it's a male and there's blood, then you would put down the amount. Trace, non-hemolyzed, or hemolyzed trace, small, moderate, or large amounts. And then ketones. And then we haven't got to ketones yet, but ketones should also be something that ranges in the negative as well. And here's ketones. And ketones are a byproduct of fat. in fats, when they start being burned as energy instead of glucose, ketones will be found in urine. So let me explain this to you. Like right now, my body is in a state of ketoacidosis because of my keto diet. So I am burning fat because my body does not have, it is not getting carbohydrates, or it's getting very little carbohydrates. And that's the reason I'm doing that, is to maintain my blood sugar. And it's working beautifully for my blood sugar. But so if a patient is on a keto diet, you probably will see ketones in their urine. Okay? Now, if you see ketones in someone's urine who is not on the high protein keto diet, then we're probably going to start thinking their diabetes isn't controlled. They've got some type of dehydration, or pH issue, or like what do you call it? Yeah, their pH is off, and either that's from dehydration or other factors. And then something that's kind of odd, we see anyone after anesthesia. Anesthesia has several weird things that it does to people's body. And if you get further into past MA, you'll learn about the weird side effects anesthesia can have for a temporary time on the body. And ketones in the urine is one of them. Here is something I want you to highlight and write down. Ketones, when you have a urine test that's testing for it, it has to be done right away. Ketones evaporate at room temperature. Okay, so that patient might have, we're looking at their keto, they're way over here and they're not on the keto diet, but you let their urine set for too long and it shows negative. Is that a really big error? Absolutely. We don't want that happening. So that's why I said time really is of the essence when we do urinalysis. Don't let it set. And then here's a word you should be familiar with, hematuria, and it is abnormal in the urine unless the patient's on their cycle. Or you might see blood in the urine if you work for a urologist and the patient has a stent in place, or passing kidney stones or something like that. But that's still, it means it's just not normal though. Okay. And then we learned this word a couple of mods back. If something is hidden, we call that occult, especially when we're talking about hidden blood. Hidden blood, like in the feces, that's why we do an occult feces, where they do the poo-poo slides. And then it's also the same with urine. If there's hidden blood in the urine, it could, what we call that occult. And that could be kidneys. And what that means is when you look at the urine, you don't see blood in it. But when you test it, there's blood in the urine. So that's what that means by the word occult. And the bilirubin is not something we find in urine. Okay? Bilirubin is a byproduct of red blood cells. If we do see bilirubin in a patient's urine, that's going to lead us to believe something's up with the liver. Okay? So you didn't know all these tests actually were telling you, they were leading you to clues on this patient's health. But yeah, it also, when we see bilirubin, it could mean the patient has mono, because mono can cause that. And we'll normally notice that patient's urine is kind of a yellowish brown to maybe even a dark brownish orange. If bilirubin is in really, really, really high quantities in the urine, we want to make sure that we put a bag over that urine and we keep it in a cool place. The reason is because sunlight and certain type of lighting will evaporate bilirubin. And that's why if you've ever had a baby who was born who, they said had to be put under the lights, it's because they had excessive bilirubin, which is normal in babies. And we talked about that because the liver hasn't caught up to the baby's body, from the excess from the mother. So, and what do they do with the baby? They put them under lights, right? So if we don't want to ruin our urine, when we have a patient who shows lots of bilirubin, we cover it. It's usually a brown dark bag or opaque bag, and we place it in the refrigerator to prevent the bilirubin from being lost. So when we do send it to the lab people are still able to see the bilirubin in the urine. I never say this right. Urobilinogen is the result of red blood cell destruction, and this is not good. This usually means that somebody has something going on with their liver or their biliary system, like the bile ducts or the gallbladder or the pancreas, that little area right there, that, how I call it the biliary tree. So when we see the results and this comes back abnormal, you can think liver issues, liver or, like I said, gallbladder, pancreas. Now nitrates, this is where we start talking about infection, okay? When a urine test for the presence of a nitrate and it's positive, this lets us know there is bacteria in that urine. Now, do they necessarily have a UTI? Maybe not. Maybe they did not wipe and clean properly. Everybody should have watched those videos on the clean catches. Who hasn't watched them yet? Everybody's watched them?
I haven't.
Okay, well, if you haven't, please make sure you do, because those show you the proper way how to instruct your patient on how to do a clean catch. The most common reason, though, is if they did clean properly and so forth, is the patient has a UTI, some kind of infection. The most common one, that, believe it or not, that we see is because of E. coli. And how did I tell you that E. coli could enter in? Is if we wipe wrong, or if there's even, I've heard a doctor saying, oh, because the feces splattered back up. And so keeping a sanitary, keeping our area, especially as a woman, because we're more prone to UTIs than what men are, is important. And this is why when we have babies, a girl, we always wipe from the front to the back. Remember, once again, that if you leave that urine setting too long, this patient could actually have an infection, but now it doesn't show it because you left the urine out too long, okay? Now, when we see leukocytes, or WBCs, we know obviously that if there's an increased amount of white blood cells, what does that tell us? That tells us the patient's fighting an infection, right? And it's most likely a urinary tract infection, so a UTI. And if the leukocytes, this is something you really want to keep in the back of your mind and write down. If leukocytes test are positive, the protein test will be positive as well. And it's very likely that the pH will be elevated, because all of those things get thrown off if there's actually white blood cells involved fighting an infection. Now, does that mean that's going to happen every single patient every single time? No, But usually, yes, when we see leukocytes or the white blood cells in urine, the protein will be high as well as the pH. Okay, so that's something to keep in mind. This is going to be part of the video I show you. This is a reference range, giving you, pardon me, if it comes back from the lab, the urine, because some people have lab work done and urinalysis done at the lab, and it comes back, that you be able to have a range to look at to know it should be negative, 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 or this should be clear, and or this should be between this number. So know your reference ranges. And do you have to sit there and memorize all of them? No. But if you, like I said, if you go, once you start, because we do urine tests on almost everybody. And so when you get in the habit, you'll start learning really quickly what's normal, what's not normal. It'll just come to you. Microscopic. Why would a doctor want to look at somebody's urine underneath a microscope? Well, and some docs do, and they'll have you prepare a slide for them. So you take a drop of the urine, and just like I showed you with the other slides, you place the drop and then you put the cover over it slightly without having it splash, and then you get it ready for the microscope. And one of the reasons that a doctor does this is so that they could see if there's the leukocytes in the urine, or they can see, a lot of times they look for, with STDs, what is it, flagella? It's something like that, but you can see them swimming in the urine, and that's a sign that there's possibly STD. So there's different things and different reasons why the doctor might want to actually view the patient's urine underneath the microscope. It helps them make a more certain decision on what the patient's diagnosis is before they send it to the lab. But usually, even if they look at it under the microscope, they're going to be sending it to the lab as well, okay? And this is all in your book, so on your textbook. And I don't know if this is the exact page for y'all, but it's somewhere wherever the urinalysis is, this is where you're going to find it. And there's 2 words that you need to know. So make sure you write these down. Sediment is exactly like what it sounds like. If you have sediment at the bottom of, a glass or a container, that's that the grainy or leftover residue, solid material that's sunken to the bottom. All right, and a tiny bit of sediment might be normal in some urine. And then the portion after because sometimes the doctor will have you take the urine, pour it into a tube, get it ready, and spin it. And then what that does is it separates the urine, the sediment, from the supernatant or the liquid portion of it, and they're able to differentiate between the two. And if I'm not mistaken, I believe that this is something that's done especially with patients who are prone to kidney stones and like pyelonephritis with, like constant kidney disease or disorders. They'll want to look at the sediment. This I already post. This is another video that I was showing you on how the lab's side of it, once you've sent that urine off to the lab. And then pregnancy testing. The main thing with pregnancy testing, I want you to remember, okay, is we are looking for the hormone HCG. And we already know about this hormone because when we studied the endocrine system, and we know the human I never can pronounce it right, but gonadotropin, but HCG basically tells us that there is life form, or there has been life form, that this hormone doesn't show up unless the person's pregnant or recently has been pregnant. And this is where I've mentioned this before during reproduction, but I'm going to mention it again. Remember, we as MAs, unless the doctor tells us, yeah, go let Miss Jones know she's having that baby, unless the doctor says that, we never say that. We never say, oh, congratulations, or anything like that, because that person could have just had a miscarriage or an abortion, or something could have happened. So we don't, and one, we're not doctors, we don't diagnose. So there are kind of some steps we want to follow when we do specifically are testing for a pregnancy test. The best time is first thing in the morning, because all of the urine has built up and the concentrations of this hormone is going to be higher in the urine. And believe it or not, even the ones from the dollar store, birth control or pregnancy oh my goodness, can't talk today. Pregnancy tests are all pretty much the same thing. They're all looking for one thing, that hormone, HCG. And they're about 97 to 99% accurate. I've had friends of mine, it was so funny. They bought one test and they couldn't believe, it come out that 2 lines pregnant. And then they went and bought like 6 more because they didn't believe the first one. And then, one of my friends, I told her, I said, how many double lines do you got to see before you realize you're pregnant? And she's like, I don't believe this. Because she was like, the situation I was in with my daughter, she was on birth control and she hadn't missed any days, but she had been given a steroidal anti-inflammatory for the same thing with me, a sinus infection, and antibiotics, and it weakened the effects of her birth control. So there's a lot of babies born that way. My daughter Sarah is a birth control baby. So and just like I said, remember, just because it's positive doesn't necessarily mean that she is pregnant. So that's why we don't say anything. That's not our job. Okay. So, but usually when both of the lines show up, that means they're pregnant. 2 lines is pretty much the universal sign for pregnancy. Now they have digital that show up and say the word positive and all kinds of fancy ones. Now, as far as drug testing, we got a couple, like 2 more slides. I am going to be posting a video and it's OSHA, when you do a drug test, and a lot of places do this, workers, especially if you work with workman's comp or those kind of things, or certain companies, and you have arrangements with them, their employees will come to you for any type of blood testing, urine testing, that kind of stuff, physicals. So if that's the case, a drug test is basically illegal, and it's binding. You're doing something that has got a set of rules that have to be followed, that weren't, made up by the doctor or whoever. This is something that comes from way, way higher above that. So doing drug testing or toxicological screening, you have to make sure that you follow the rules and that you follow the procedures exactly. And that's for every single patient that comes in, because if you don't follow them properly, say one of them is that the lids are sealed and taped, and you're not supposed to crack them until you're by the patient, so the patient knows you didn't tamper. And just like the door is supposed to remain cracked, and the water and the toilets and everything are stained a certain color, so that there's no chance the patient can pull urine from the toilet or turn on the faucet or that kind of thing. So there's lots of procedures. The video that I'm going to be showing you is going to go over all of that, okay, and explain to you the importance of it and the procedures of it. And sometimes we'll be asked to perform a drug test in the office. And if that's the case, the test might look like this. And you can see here that they've got some amphetamines, cocaine, opioids, PCP, barbiturates, oxy, MTD, and THC, so different things like that. So this one shows that it's positive for opiates and marijuana. So we would look, okay, so that's 3. Yep, it was a positive line. And then the opiates was 1. Yep, that was a positive line. So we see there. And each one of these kind of tests, there's hundreds of different tests like this on the market. So each one of them, you'll have to know their instructions on how they work. But they're very similar to a birth control or, I'm sorry, I keep saying birth control. Pregnancy test and like the dipstick reagents test, okay? But the main thing is quality control, because the urine specimen that you get or that you take from your patient, you know, if it's done improperly or if it's done, it might be thrown out. And maybe that person was, you know, high, or maybe that person did have things in their system, and that's why they were injured at work. So we want to make sure that we follow that protocol. And I said the video that I have for y'all will be very good at explaining that, okay? And somebody wanted to come and say hi. Look, say hi. Oh, Christine. All right, guys. Well, lecture's done, and hope you learned something. And I'm gonna go ahead and post this for everybody else who's not in there, but let me get a real quick, where is it? Members, participant list, download. Thank you very much. And then now I'm going to stop recording.